Hello.
Hi, this is Kayla. How can I help you?
Hey, Kayla. I'm here with Nick.
Hey.
And his brother's deaf. That's why we're calling on behalf of his brother.
Okay.
We don't know if being deaf hurts. I don't know if there's any discomfort in being deaf besides that he's got hemorrhoids. Mm-hmm. Nick's brother. Do you know who Jason Siegel is, by the way? Jason Siegel. Have you ever heard that name?
Sounds very familiar.
Do you know where you're not familiar? You don't know who that is, though?
No.
So we were looking to get, we want to
get him. We want to get his hemorrhoids lasered off.
I see. Okay.
So do you have, and then side question is that Nick was thinking about, and we're not in the medical field or anything, but Nick was going to get LASIK surgery. So we were wondering if that is something that you could use the same laser for. If there's like a setting, you could do a LASIK and then you could do a hemorrhoid.
Not typically. You don't ever want to do multiple procedures at one time.
Yeah.
So, but there is a setting. You can use the same laser for hemorrhoids and LASIK. You just have to do it at different times.
No, they're different. They're different.
So it's not just.
And it depends on how bad they are. So the first thing is, does he have insurance to come in for a consultation?
Does he, Nick?
I don't know.
We don't know.
I asked him, but I don't know sign language.
Yeah, it's a little hard to communicate with Nick's brother. He's deaf. I don't know. He can't hear.
Okay, so there's no sign language interpreter or anything like that?
There is. She's not here right now. And he
just kind of confessed about the hemorrhoids.
He drew a picture.
Okay.
And it was like,
okay, yeah,
because I don't even know what hemorrhoids.
There's different grades to hemorrhoids, and there's different ways to treat them. So the best thing to find out is whether he has insurance. Well, the picture, which I'm assuming he probably does.
I think he does, yeah, because he got. I think, do they do laser treatment for hearing, like LASIK? They can't do that.
I do not know.
Yeah. But the picture he drew that maybe he could help us, because it's like it's a drawing of buttocks, and then like in the middle, like between the cheeks, I guess he drew like a bunch of like I don't know, like hemorrhoids, I guess.
Lumps.
Yeah, like bumpy. Cherries. Yeah. Like
yeah,
bulged out.
I mean, the only way to diagnose him properly is to actually physically see him. Do you guys live here?
We do. We could fax the drawing over if you have a fax number.
Yeah, it's not usually done that way. He has to actually physically be seen by the doctor so he can determine exactly what it is he's looking at, because it's just not going to compare to physically seeing it.
Okay.
And typically, if he has medical insurance, they should cover, obviously he probably has a sign language interpreter, but we could check and see what his insurance would cover. If he's able to come and see us, we could schedule him right away. That's not a problem.
Yeah, sometimes I feel like his interpreter's not really saying what he's telling her.
I'm sorry?
Yeah, he's not talking into the phone.
Oh, sorry. All right, well, thank you.
Okay.
Yes, you're welcome.
So
yeah, and if he doesn't have insurance, we can see him as a cash patient as well too. The doctor's here on Tuesdays and Thursdays, and he's pretty much available on any Tuesday and Thursday. You guys can bring him in.
Okay.
How much cash is that just to get one hemorrhoid lasered off?
Well, you probably want to get them all done,
well, the
right?
consultation is $240. Normally we charge $300.
Okay.
But depending on the grade and of the hemorrhoids determines on what kind of procedure he needs, and then we just put that $240 towards that.
And the doctor will have to look at his actual hemorrhoids. Like, he can't just look at the drawing. We all have to tell.
We would physically need to see him, in the office with the sign language interpreter. And it's a pretty quick evaluation. It's just,
now we're talking about a lot of people.
That's the only way to determine the level of hemorrhoids he has.
So this is going to be a lot of people in the room.
No, it's just him and the doctor.
But then the interpreter.
And the sign language interpreter.
And then Nick's
going
to want to be there. I mean, I can wait
Yeah,
in the
it's
waiting
just me
room.
and the doctor in the office.
So you too. So now we're talking 4 people, and he's probably going to be, I mean, for lack of a better term, showing his butthole to everybody.
Well, I mean, to be honest with you, he wouldn't be the first one that we've seen, but I wouldn't be in there with him. It would just be the doctor and himself, and then we can just have the sign language interpreter tell him the instructions we need him to do, and then the doctor would just, take a look, and then he can get dressed, and then the sign language interpreter could come in and explain everything that the doctor's seen. Okay.
And the doctor operates the laser, or is there a different guy who comes in to do that?
Yeah, okay. There's different ways to do it. There's that. There's excisions. There's sewing. There's stapling. There's all kinds of different ways.
Okay, we'll take a look, or we'll try and figure out how to get his brother in there.
Sure, sounds good. Thank you.
Thanks.
Bye.
Bye.